Today at Skills Fair, we're going to teach how to do EKGs. First things first, you need to have an order, a doctor's order. Then your machine, you will have to unplug it from the wall. Make sure to turn it on. It will take a few seconds for it to fully load. Once your machine is finally on, again, make sure you have a doctor's order. You will hit the ID button, and this screen will show up. On this screen, you can either use your patient sticker or your order, and you need to use your medical record number and your account number. You do not need to use your V or your M or any of the zeros, but the remaining main numbers is what you need to use. Put the patient's last name, first name, their age. For if you're doing a ped, this box will drop down, and you can change if they're months, weeks, days, or hours old. Then you'll put in your gender. Your operator will be your first and last initial. Your diagnosis, you can use CP for chest pain, tachy for tachycardia, you can abbreviate. Your doctor's name will be the doctor that ordered the EKG. The room number, your department name. You cannot free text on here. You have to drop the menu down. So say if it is on second, you will hit 2 and drop the menu down. Fourth, you will hit 4. ICU, you'll hit the I. Then you will hit OK. It's prompting me that I don't have all my fields required. Once you know all your fields are required, go ahead and hit OK. You will have this blank screen with all the red lines on it until you have your patient fully hooked up. That will remain that way. When hooking your patient up, you need to count 4 intercostal spaces down. You will have one on the right and the left of the sternum, V1, V2. V4 will be mid-clavicular, 5th intercostal space down. V6 is mid-axillary, the 5th intercostal space down. V3 goes between 2 and 4. V5 goes between 4 and 6. Each arm and each leg will also get one as well. Do remember that yes, these are labeled, but not always are they labeled correctly or the right wire. So make sure that you always go to the base and look to make sure that each wire goes to the proper place. Once you fully have the patient connected and hooked up and your circuit is complete, make sure on your screen that you have a rhythm. All lines will be with a green rhythm. If you see this screen still after you know your patient is hooked up, then you have a limb, either a leg or an arm, is disconnected. You don't have to go through and make sure each lead is connected on the body. Once you have all your green rhythms, this green button here should light up green. Once that lights up green, hit the button. It's analyzing, and this is your screen, and you will have your rhythms across here. Once you come to this screen, hit the print button, and it will print off here. Once it is done printing, you will hit the close button. If for any reason that you were to have a code, do this step first. Place your leads and your tabs and get the patient hooked up first. Then come to your machine and hit the green button. Give the printout to the doctor. Then you can come back and edit and put in your information. For peds, there will be a smaller area that you will be having all the leads in. It's okay, they will touch each other. And if you need to calm the baby, use a little bit of sugar water. And that is a basic 12-lead EKG.